Hello again, everyone. This session is about current trends in public health, particularly the global issues, no, and national issues that we are now confronting at present, and also identifying our roles, no, uh, amidst these issues and concerns. Now, let's talk first about global health. Global health responds to health issues globally, where each country have their issues and concerns due to certain factors, no, like environmental change, technological change, and other underlying circumstances or crises. And global health usually focus more in the on the health of the people, the problems, the issues and concerns of particular nations. The individual people, the families, population groups, and communities, you know, in that particular nation. So global health uh, is an area of study. It's actually a vast area, you know, to be studied, where many research activities can be undertaken. And also, it's an area of practice that plays a priority on improving health and achieving health equity for all people worldwide. Now, to address global health concerns and also to achieve health improvement, uh, there is a need for collaboration, not only within the nation, but also within nations. Engagement and collaboration um, globally, amongst the nations concerned. Like, for example, right now, in the midst of COVID-19 pandemic, just like what happened lately in South Africa, with them being able to determine a new variant in their laboratory, the new variant Omicron, and which actually helped other nations also to come up with their uh, control measures. And imagine if sometimes in December 2019, no, when China was still, uh, when China first experienced or first saw also the existence of uh, SARS-CoV at that time. And if uh, preventive measures were done more uh, promptly, then maybe, yeah, maybe it would be a different picture right now. But then, of course, yun, this only proves, no, that collaboration is indeed very important, especially in the face of a health crisis that concerns concerns the world. No? Also, another uh, key key role is culture competency. No, culture competency is very important in addressing global health concerns. We need to take into consideration the differences, no, in our customs, our traditions, our culture, and yeah, consider these differences um, into account whenever we are planning, for strategies. So we must be responsive to the unique needs, of every culture, and be respectful, of these differences. So with cultural competency, global health concerns will be more addressed. The healthcare delivery system will be more responsive and thus achieving more healthcare improvements. Research is another key has another key role, in addressing global health concerns. Um, like right now, for example, with the COVID-19 pandemic, research in terms of understanding the characteristics of the COVID-19 variants are very important, so that each nation, can come up with their with a more responsive, distinct control measures no, that specifically will cater to the unique characteristics of whatever variant that is existing. Like for example, diba, during the time when the Delta variant emerged, and now that we are just starting to understand, the Omicron variant. And if you remember before, during the early part of the COVID-19 pandemic, before the world was able to come up with strategies on how to plan for vaccines, for ways to manage, the COVID-19 effects on people. Research studies focusing on understanding the characteristics, the virulence, the pathogenicity, and even the attack rates, etc. So these are to be studied, as well as the impact the COVID-19 is making on people, disease surveillance, as part of research initiatives, and a lot more. So research related activities play an important role in addressing global health concerns, and in achieving health improvements. Okay. Now, amongst the global health issues that we are confronting right now is, of course, the emergence of infectious diseases, and in the future, other potential pandemics. Um, right now, we have the coronavirus 19, the COVID-19, which is an infectious disease caused by a newly discovered coronavirus. So I'm sure uh, you have known many things already about COVID-19, which was first identified, in Wuhan, Hubei, China in 2019. And then just right in 2020, more than 13 million cases. July 14, 2020, more than 13 million cases already have been reported. So right now, November, uh, I mean, December, we are now in the month of November. How many millions of cases were already reported now? So maybe you can take a pause and you check the Corona Tracker, from WHO as well as in DOH. Okay, so it's important that as nurses, we are following through with the latest development in this COVID-19 pandemic. It would also help, that we follow through with the symptoms, the common symptoms as well as the severe symptoms. And now that we have this Omicron variant, yeah, so we have yet to see, what are the severe symptoms, and if really the vaccines, that were introduced to the people, that were used by the people, will be adequate, to protect themselves, to protect the people from more severe symptoms, of the COVID-19. Um, I will not be discussing any more of these modes of transmission and also these protective measures, because I'm sure you have been following through. It has been 2 years already that we are in this pandemic. So I'm sure that you are very much familiar with these protective measures to prevent coronavirus transmission. Okay, but just the same, as we try to deal with our patients, uh, especially that next year we might have our face-to-face duty na, no? So again, we need to contribute, to help promote and to help remind the people about preventing coronavirus transmission, even in the midst of uh, people being vaccinated already. No? Because yun nga, it's not a guarantee right now, especially that the virus continue to mutate. So yun. Another global health issue, that confronts the people right now is issues on mental health, especially with the limited mobility, and limited social engagements for the past 2 years. Indeed, mental health had been one of the concerns, main concerns of the people. And the World Health Organization recognizes the importance of psychological well-being, defining health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And uh, studies revealed that in 2018, of the estimated 792 million people worldwide living with mental or behavioral disorder, 178 million of these were drug or alcohol dependent. 20 million were diagnosed with schizophrenia, and 264 million suffered from depression. So take note, no, 264 million people were suffering from this depression in 2018. Just imagine right now, into 2021, after the 2 years crisis of the brought by the COVID-19. Okay. So mental disorders such as depression, anxiety, which people encounter due to pandemic, affects millions of people worldwide. Also, the loss of loved ones, family and friends, loss of jobs, lalo na ngayon, and economic crisis because of businesses closing and being bankrupt because of limited economic movement. So it adds to the enormous global burden that consequently affects functioning and quality of life among the people. Okay, so also decision making and problem solving can be very tough in today's situation given all the limitations. Another global health issue is issues on climate and weather, because extremes not only may affect transmission of the SARS-CoV or the coronavirus, but also the ability of health systems to respond effectively. So as the frequency and severity of some extreme weather disasters increase, the COVID-19 pandemic illuminates the special challenges also to health systems of concurrent events on cumulative hazards and stressors. So public health systems need to be able to deal not only with the COVID-19 pandemic, but also the health consequences of heat and extreme weather, and as well as the interaction between the two, if there's any, such as impacts of heat and extreme weather on healthcare workers who may be working in vulnerable temporary facilities. Diba? Many, since hospitals are have limit, are some hospitals are full. There were reports previously, of hospitals not being able to accommodate any other patients anymore. That's why patients sometimes are accommodated in the driveway, in the surroundings of the hospital, putting up tents where these patients can rest, and setting up temporary shelters where some of the medical facilities can be made available, like the oxygen and etc. So, but especially during summer, na sobrang init. Tapos nandun ka sa garahe and then you're not feeling well. So what will happen all the more? And in the same manner that also the healthcare workers, how with their PPE, amidst that very hot weather. So definitely, will make them more vulnerable to developing diseases as well. So COVID-19 is a serious threat and continues to be a major focus of concern, but the global environmental health community also recognizes the persistent environmental threats, which will still remain beyond the current pandemic. Another concern is the non-communicable disease. Such as heart diseases, you know, those who have cerebrovascular accidents or stroke, those who are suffering from cancer, those with chronic respiratory diseases like COPD, etc., and diabetes, no, which are the leading cause of mortality in 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 the world. So this invisible epidemic is actually an underappreciated um, cause of poverty and hinders the economic development of many countries. According to studies, non-communicable diseases kill 41 million people each year, equivalent to 71% of all deaths globally. So yun. So morbidity and mortality uh, arising from the non-communicable diseases, can be monitored through the web pages of the Department of Health and also the WHO. So people with non-communicable diseases are more vulnerable. Also, were reported also to be more vulnerable to severe COVID-19 and death. Uh, COVID-19 and non-communicable diseases share a common set of underlying risk factors, which includes deprivation, obesity, uh, older age, ethnicity. Mm. Also, the incidence of cardiovascular and respiratory diseases that increase the vulnerability of individuals and communities to pandemics similar to COVID-19, no, is also is also part of the issues not faced in terms of non-communicable diseases, and it generates uh, wider benefits for public health, well-being, and resilience if the communities, no, if or if the healthcare delivery system will be more uh, will continue to be responsive, no, to the needs of the people suffering from non-communicable diseases. Now, we have mentioned a while ago that we are to discuss uh, nurses' role, no, amidst these global concerns. But first, let's discuss first the core competencies that are needed, of the public health nurse to be able to respond to these global health concerns. First is, of course, sufficient knowledge, sufficient knowledge of major global health risks, um, not only with COVID-19 right now, but also other diseases such as HIV, AIDS, tuberculosis, and even lifestyle, ano, or habits such as smoking, causing problems, health problems to people, as well as the environmental hazards. It's also important that a public health nurse is knowledgeable about epidemiology, disease, and particularly disease causation, the also be able to understand the interaction of factors, that is causing the disease, and also understand, how epidemiologic investigations are being conducted. So, and also understand how to contribute to that epidemiologic investigation. Okay, nurses or public health nurse also must have the skills in community mobilization for integrated health development. And also needs to have knowledge and skills about immunization. We have recently conducted the national vaccination program for COVID-19, and even student nurses were asked to volunteer. I saw some students, fourth year students who volunteered as vaccinator. So in your case, especially I really hope that next year we will be able to go around different uh, different agencies, different institutions, so that you will have your hands-on experience no, on immunization. Manila Health Department alone, no, kasi we are partnering with Manila Health Department. I'm assigned in Manila Health Department, so usually in the morning we have as many as 60 babies that needs to be immunized. So imagine, if you will be able to be rotated, we hope next year, even in Manila Health. So 60 babies alone every day. I'm sure you will develop your skills. But of course, you need to know first. You need to be very familiar with the immunization procedure before you will be given the chance to perform one. And you will be performing the immunization, of course, under the supervision of your clinical instructor. So yeah, well, I hope I will have the time to be on duty sa Manila Health early next year. Also, a public health nurse needs leadership skills. We you from time and again, we have always discussed the significance of the roles of nurses as leaders at the point of care. Since especially that we coordinate everything. So our leadership skills at the point of care, of the patients is very important for better patient health outcomes. If we will be able to navigate, and to lead the patient and the family and other members of the healthcare team and coordinate very well, the different health activities that will benefit the patient, then maganda yon. So yun, just imagine, without that leadership, the patients and the families will be lost as to what is the next step to do. So yun, a leader, a guide, a coordinator, an advocate. So those are just and we need to develop skills, in order to do this. Also, skills in preparing nurses to be ready for emergencies and crisis situations is another core competency of public health nurse. Disaster planning and intervention skills are also important. Ability to enhance team building and leadership abilities of, as healthcare providers and planners, which we have mentioned a while ago. Public health knowledge, also very important. Skills in demonstrating cost-effective care through primary healthcare and the critical role of nurses in the healthcare team. Specifically, the role of the public health nurse in a pandemic falls into the categories of prevention or mitigation, preparedness, response, and recovery. So these are the critical components of public health nursing practice. As you all know, public health nurses are the largest segment of the public health workforce. And we are the most trusted profession. We serve as community advocates, and we need to possess the knowledge and skills to respond in a timely and appropriate manner to any type of disaster. Also, the public health nurse must be a global health leader. Especially in leading change. Effective. So we should be effective change agent. And an effective change agent is disciplined, thinks rationally, with open mind, and is informed by evidence. So that disciplined and rational mind and open mind should be coming from your knowledge of the current evidence. So that's why you have to be comfortable in checking current literatures. Um, like I'm sure that you have recently been reviewing literatures while you are conducting your research proposal. Diba? You review the literatures, and also sa nursing informatics naman, you came up, you were asked to do an online survey and were asked to write your manuscript after the data gathering. So I'm sure that this semester, you had many opportunities to check on the current evidences, on the current literatures. Uh, First from screening the titles, and then screening the abstracts, and then reading the full text. So you have to be comfortable doing all these things so that you will become an effective change agent. Okay. Um, Global leadership requires vision, strategic thinking, credibility, and ability to work with the influences uh, of others. And you will be able to do all these, if if you are guided, if you are informed by the evidence. All leader becomes global citizen and someone who works to make the world a better place. And global citizen must respect the diversity of others. In being a global health leader, nurses must utilize an interprofessional approach and must be culturally competent. Interprofessional, you will need to collaborate with the different members of the healthcare team or different departments, different organizations. So an interprofessional approach is needed and must be strengthened. And we, as I've said a while ago, we need to be culturally competent nurses. We need to be cognizant of the differences and be able to respect these differences, between people, between organizations, and between nations and cultures. Okay, so I think that would be all. Thank you everyone for listening. If you have again questions, please free, no, to feel free to message me. Thank you.